Hi, this is Dr. Sarah Bhutan from Personalized Physical Therapy and Wellness, and I have Valerie with me. Valerie and I were having a great conversation about the improvements, the changes that she has made over the past 4 months that we worked together. But more importantly, her understanding and her philosophy of the body at this stage, the stages of her life that you've gone through, and what you're entering into and how you're preparing for it. Valerie, do you mind going into that a little bit for us?
Well, I was telling you that I've seen our working as functional physical therapy because I didn't come with an injury, but my husband and I have been athletic and active our whole lives, and we've pushed for run the farthest, run the fastest, lift the most, whatever the best performance is.
Yeah.
But now we're in a period of our life where we want to stay active,
Right.
but our bodies are changing, and so we really need to learn how to activate other muscle groups to take the load off of those ones that are wearing out. And then sadly, they're wearing out. But the other thing is just educating ourselves as to, if we've been active for 30 years, how can we stay active the next 30 years with bodies that are changing? I'm not gonna say aging.
Well, I would say getting wiser. How about that?
I like that better.
But you're right, because you're changing, and it's changing in a way that you don't keep training the same way you did for the past 30 years. It's a little bit different the way you look at it. And I really like the layer analogy that you explained, if you don't mind going into that.
So I feel like as we've been young and active, you talked about in your workshop 3 layers of muscles, sort of like the superior, the medial, and the inferior, or something like that. And that we've always trained those superior ones, and when you're younger, those are the most active ones, the strongest ones, and you keep pushing them. But because we've pushed them so much our whole lives, they're starting to age out first. And so really what I wanted to do was, through physical therapy, learn how to engage those inferior ones that haven't been used my whole life, but to support and keep longevity for those ones that are aging.
Yeah, no, I should say getting wiser.
Yes, getting wiser.
Yeah, probably David will be really excited because he's into the wine business, so
There
he
you go.
probably will connect something in there.
There you go.
Yeah.
But I do feel like that over the course of time, what you've done is made me aware of some muscles that if I would develop them, that I've never had to, because I didn't have to when I was 20, 30, 40.
That is a great point.
That I need to develop them now, not that the other ones are shot or injured or need replaced, but because I need to support them.
Yeah.
So kind of, it reminds me too, in just the whole way of our skin ages. So like I never used any skin products growing up or whatever, but now as your skin gets older and sort of, you need things to help moisten
Support
it.
Yeah. I like the analogy of this army combat situation, and there are groups of teams that have important roles, and when it's the wartime, let's say, everybody gets in and gets into a role, and they all need to be supported each other and sort of change roles as needed. And so that's what we're doing, is handing off some responsibility to the ones that may have been more into reserves, and now recruiting the reserves.
Yeah,
so
that's right. That's good.
Amazing. Yeah.
That's good.
Well, thank you again, Valerie.
Yeah. Well, and the other thing that we talked about, which I do feel like it has helped me, there are day-to-day activities that have never been hard for me because I've always been active. But as I age, they get harder because things are wearing out. So trying to integrate the exercises you've given me into going up and down the stairs or sitting up and down, so that they become functionally part of what I do day to day, not just in my 5-minute routine.
Wow. Yeah, that's going to go along because, again, you don't want it to be a chore.
Right.
It's not like, am I going to be exercising all my life? It's not the case. You want to be integrating it into it and then moving on to the important
Because
things.
the whole point of doing it is so that you can do those day-to-day activities more easily.
Well, thank you again, Valerie. Thank you, everyone, for watching, and we'll tune in again on another show.